My name is Aaron Fenster. I'm at the Robarts Research Institute in the imaging lab. In this lab, we are developing various types of instrumentation to guide therapy using minimally invasive techniques, as well as diagnosis of disease. Specifically, we're focusing on cancer of the prostate and also vascular imaging, and more recently, liver cancer treatment. So I'll describe the first invention of ours, which is right here. This is a device that we invented. We have about 6 patents covering this device, and it's already been licensed for sales worldwide. This is a device to guide prostate therapy, to be able to insert through this needle either seeds or other therapy devices into the prostate. So this is a mock-up, and now we're going to do a scan to show you how this works. So if we activate the device, you'll see the ultrasound transducer, which is spinning, generating a 3D image. And then now you'll see the 3D image being generated, and this, you see it moving, and within about 5 seconds we generate a complete 3D image of the prostate and able to guide the therapy of the prostate. Now this is for therapy, but we also invented a device for diagnosing disease through a better way to do prostate biopsy. So this is the prototype of the device. And you can see it's fairly complicated, and it also has about 5 patents covering this technology. This is the ultrasound transducer, and it's used to guide the biopsy. But again, this technology allows us to make a 3-dimensional image of the prostate and guide the biopsy to exactly the right site, integrated with other imaging modalities such as magnetic resonance imaging. Now this technology, as I said, has been patented and also been licensed for commercialization, and the commercial version is in fact right here. So this is the commercial version it's going to be used worldwide. You can see the spinning rotation to produce the 3D image, and then the manipulation of the transducer with encoders to be able to know exactly where in the prostate the biopsy was obtained. It's now into clinical trials. We are setting up a multi-center trial in Ontario between Toronto and London to study the efficacy of this device for managing patients on active surveillance for prostate cancer. And the next device we have invented is over here, and I'll step up. And this device is for imaging the carotid arteries, which are the vessels in the neck supplying blood to the brain. Now, as we age, we develop hardening of the arteries, or atherosclerosis, and if it's extensive disease, then we are at risk for having a stroke. So to obtain a 3-dimensional image, we place an ultrasound transducer in this device, held it against the neck, and 7 seconds later, we obtain a 3-dimensional ultrasound image of the neck. And then we analyze the images to be able to quantify how much disease there is in the neck. This technology has been licensed also to a company for sales in China, and it's going to be ready to be sold. This is the prototype, so ready to be sold in a few months. We have developed some other technologies. Now we're focusing on liver cancer. We have developed technology to guide focal therapy of liver and other devices. So with that, thank you very much for walking through my lab. Hope to see you visiting our lab at the Robarts Research Institute.